Good afternoon, everyone. Welcome to our COVID-19 update for our part of the state. It's nice to have people here again to hear updates on what's happening in Eau Claire County, what we are doing related to COVID-19, and to get good information so you can make decisions moving forward. Today is Wednesday, May 13th, and today I'm joined by Dr. Ron Walsh, the Interim Superintendent for Altoona School District. Ron is here to share some perspective for preparing for and responding to COVID-19 as it progresses throughout the course of this spring and summer, as well as next fall. So we're glad to have him as one of our many partners working to respond to COVID-19. I'll give a little update on the state, on Eau Claire County resident numbers, some background on some of the things that are going on, and then after both Dr. Walsh and I share, we'll be back to answer questions as well. So the state status. In Wisconsin, we now have 117,111 negative tests, 4,363 increased from the last time we reported, 10,902 confirmed cases of COVID-19 by testing, an increase of 291. And 18% of those have ever been hospitalized, a total of 1,908 people. We are now at 420 deaths for COVID-19 in Wisconsin. In Eau Claire, we have 63 confirmed cases of COVID-19 by testing, an increase of 2 from Tuesday. We do have total at this point 2 cases of COVID-19 identified from our community testing event, and we'll be talking more about that later. 3,205 Eau Claire County residents have been tested for COVID-19, an increase of 223. Of those, 311 are negative and 131 are pending. This number is higher than what we usually report related to pending results and is related to our community event as well. 40 people have been released from isolation of that 63 total. We still have people across the age span, and we really are seeing COVID-19 in all ages across our community. Newly reported today is a state statistic related to facility investigations. That is a report that the state is doing now about investigations that health departments are doing in each community across the state. They were previously reporting that by region. Now they're reporting it by county. We do have workplace investigations and group housing investigations happening in Eau Claire currently. Statewide, as well as locally, the daily testing numbers are trending upwards. That's happening for a variety of reasons. We know that the testing capacity is increasing statewide, and we are having increased testing because of events like our National Guard testing, but also outbreak testing happening as well in some parts of the state. The positivity rate remains about the same for Eau Claire County, the number of tests that come in, of those, what percent are positive. That positivity percent is 2% or so for Eau Claire County and 9% for Wisconsin as a whole. Our 7-day positivity rate is declining a bit now that our test numbers are going up. Today, the community testing site at Thorpe High School is happening until 7 p.m. We do encourage people to go to that, especially those of you that live on the eastern side of the state and might be able to get there easily. Again, people with symptoms, even mild symptoms, are encouraged to go to that community testing event, and it is free. For those of you that have interest in knowing about our testing event locally on Sunday and Monday. Again, a reminder, we did our community testing event as a partnership with our National Guard partners and Prevea. Those 2 days, over 504 tests were done in those 2 days, which is an astounding amount for our area. We were pleased to be able to partner with the National Guard on that. Not all of those tests were of Eau Claire County residents, but the majority were. We did have people from across the area get tested at those 2-day events. The results are reported back to the local health department where the test results need to go. So the resident gets their results reported back to that health department. We've gotten most of those results back to our health department, but some we are still waiting on. In addition to the staff that really supported that event locally, as well as law enforcement and the National Guard, the officers that were there, the soldiers who helped make that happen, we're also really thankful to the local businesses that helped to donate to fuel the people that were there on site. And I did not mention that on Monday, but a special thank you to Mancino's, Coffee and Bagels, and Papa John's, who donated various food items for the National Guard and for the staffing that happened at that event. Again, that event was to really do a good job capturing anybody that had symptoms during those 2 days. So mild symptoms is something that we are encouraging people to get tested for. And that group of people with very mild symptoms may not be easily getting tests happening elsewhere in the community. So we had a 2-day event to really capture as many people as possible with those mild symptoms. That's the criteria that the National Guard has for their testing events and for their test use. And we were pleased that we got as many as we did locally. That's certainly a very large number compared to testing events that are happening elsewhere in the state. Related to state update, the Supreme Court decision is we are still awaiting that Supreme Court decision. On Monday, the last time we talked to you, that night at midnight, the public health emergency declaration for the state of Wisconsin expired. That did mean the end of some things in the state related to work that we are doing related to COVID-19. It did not end the current Safer at Home order and the status of that order in our state. So a reminder that while some people, it's a bit confusing, the public health emergency declaration did expire, the Safer at Home order did not expire. That means that all of those things that we've talked about previously about keeping your circle small, leaving for essential reasons, and following the order related to which businesses are open and what we all can be doing is still in place. The state also reported late yesterday that 5 of the 6 metrics, 5 of the 6 measurements that are happening regularly to see if we can move from Safer at Home to Phase 1, 5 of the 6 of those have been met. 1 remains unmet, and that is symptoms related to influenza-like illness. Those influenza-like symptoms that are tracked need to have a downward trend for 14 days, and that's the one that remains. Eau Claire County is tracking some of those metrics locally. Of particular note is that we do not have a downward trend for 14 days of our positivity rate in Eau Claire. You may remember that I reported on that going up rapidly as we had a very large increase in number of cases last week. It's starting to go down, but we certainly have not met that data point locally. The change happening in our move from Safer at Home to Phase 1 will be based on statewide data, but we are certainly tracking it locally. A couple of additional local updates before I turn it over to Dr. Walsh. So first of all, if you have healthcare needs, even if they're not related to COVID-19, and particularly if they're not related to COVID-19, if you have healthcare needs, please know that hospitals and clinics in this area are working hard to make their spaces safe for you to come into. We want you to take up the healthcare that you need. They have policies to make sure that people stay safe, and we want you to be in touch with them if you have care needs that are not being met. If you need care in emergency, don't wait. If you have non-emergency care, please talk to your healthcare provider about how those needs can be met. We are getting some questions related to playground and sports equipment. Playgrounds remain closed in the Eau Claire area and across the state. We know that this is hard for young families. I encourage you to find other creative ways outside for kids to interact. There are many other things to do in the city of Eau Claire and across Eau Claire County that don't involve playgrounds, and I encourage you to find those spots to do that. I was sharing with a friend of mine, if I had little kids still, I would take them, if I lived in the city of Eau Claire, for people that live here, there are wonderful places where kids can, with shadows, follow lines on streets and do things that will manage their creative impulses and get them moving. So playground equipment is tough, but there are other things to do. You will see signs in the public across our county to use the resources that we have out in the public in a way that is safe. So maintain physical distance, clean after yourself if you're in a place that you're using something like a tennis court and touching things. Please make sure that you are respecting those spaces so others can use them safely. I will now have Dr. Walsh share with us some input on what schools are doing, and then I'll be back up for questions after that.
Thanks, Elizabeth. Again, I'm Ron Walsh. I'm the interim superintendent in Altoona. And to give you a little update on what's going on in our school system anyway, and give you that perspective, we're focusing on some priorities. And our first priority for the school system right now is for teachers to stay connected with their students. That's number one. Number two is to engage the students in a variety of activities using resources and applications that the students are already familiar with. So those are our first two priorities. Another priority of ours is to provide meals for students. That's kind of a fundamental thing that we know about in education, that kids need to be. They learn best when they're not hungry, and we need to make sure that they're getting nutritious meals. We're providing over 600 meals a day that our families are picking up, usually about 300 families or so. We pack a lunch a pack that includes a lunch and a breakfast, so combined that's about 600 meals that we give out each day, each school day. I've talked a little bit to the principals that have surveyed parents because we're very interested in how they feel about what's going on with instruction at this time. And the overwhelming feeling from the parents that we've polled is that they feel that we are providing the right amount of instruction. Now, there still are a few that think it's too much or too little, but those are kind of outliers. We're still in that 90+% of parents that feel it's about right. We think that's important because parents have, like it or not, become deliverers of the instruction to a large degree. Most of them haven't signed up for that, but that's where we're at this point. And they're doing an excellent job. We're trying to help with that situation through providing technology. We've given out, not given out, but we've loaned out approximately 650 Chromebooks, 450 for the high school and the rest for mostly intermediate middle school students that need them at home. We're also providing loaned out some hotspots for families that don't have any access to the internet, because if you don't have access to the internet, you're missing a lot of the platforms that are available at this time. Teachers as well have checked out some of the materials for their own use because they're trying to produce videos and get videos and different types of things that they need to get out to students and receive from students. So they've needed a little more oomph sometimes to get that available to them. We've expanded our virtual private network so that there can be more video sharing and some of those things with teaching resources online as well. But we also know parents are overwhelmed, and a lot of parents are taking on this responsibility, doing a great job of educating students along with the teachers. We know that a lot of them are working from home and teaching from home and parenting from home and cooking at home. It's a challenge. We don't realize that it's very stressful. We're trying not to overload families with education at this point. We're trying to provide what's enriching to students. Looking ahead, we're waiting to see, like everybody else is, what's going to happen, how things will eventually loosen up and when they will. We'd like to be planning more for our summer school programs. We're We're tentatively planning to do some things maybe in July, hopefully in August. We've had to back off from June things at this point. For the fall, that's a big wait and see, but we are doing some things, getting ahead, making class lists. We're waiting again to see what's going to happen with things, whether they loosen up or not, if we're going to have to provide different types of education in the fall, similar to what we're doing now, or if we're going to have to create some hybrids from what we had in the past to what we're doing now. We'll have to wait and see how loose things do get. Is there any questions on anything that I've said? Otherwise, I'll turn it back over to Elizabeth. It's all yours.
Thank you, Dr. Welsh, and I'm sure if additional questions come up related to schools, we'll have you come back up and share that. Again, thank you to everybody who is working to slow down the spread of disease in this community. It is working. We know we will have people that test positive. We know that we will have continued increased numbers, but the slower we can spread the disease in this community, the better for all of us. And we appreciate what everybody's been doing to work on that, both individually and in your work sites. A reminder about our COVID call center number, that is 715-831-7425. That's the number to call if you have questions after looking at the website and looking at the materials, both locally and at the state level. If you still have questions, please call. There's someone there that will help to answer your question or find an answer and get back to you. Do know that our website is covid19eauclaire.org. That website is being updated every day, multiple times a day, sometimes by a team of people that's staying on top of information. We know that COVID-19 changes regularly. The orders from the state and the local situation change regularly. It's been one of those diseases and why we've been doing these regular media events, because things change. We want you to have the right information. We want you to have the updated information, and please go to that website as a starting point. So we are available for questions now. Yes?
Walk me through what a facility-wide investigation, one's a workplace and one's a component. So does the workplace shut down during the course of the investigation? Do you move everyone out of this group home, whatever that is? I guess what's the process?
So the question is, with the state recently reporting public health investigations on their website, and that is at a county level now that's reported, what does it actually mean to have a public health investigation or a site-based investigation happening? In every case of COVID-19, we do a very in-depth investigation of that positive case. It's true of all of our communicable diseases. When there is potential for a location spread happening, so someone is working in a location or someone is living in a location where many other people are beyond a family or a home, there's work done with that facility to make sure that spread is contained. And so while every situation is different, so there's not an easy answer. The question was, does the work site close down, for example? There's not an easy answer to that question because every space is different. We don't empty out or close down a facility just because there is a case of COVID-19. We do work with every facility to make sure that the right response happens. So those people that are the closest contacts, and again, that's within 6 feet, so it has to be a very close contact, high risk, those people are told to stay home for 14 days. That's the quarantine we've talked about regularly. So in a workplace setting or in a setting where multiple people live in the same facility, those people that are in close contact and meeting those definitions would need to be quarantined. Sometimes, if it's a group living situation, we do have to move people out of that situation, some of them, so that they can be safer if it's their choice. And sometimes they can stay in that same spot and be quarantined successfully. Again, very dependent on the individual location. And the same with a work site. If it's a very small work site and everybody had very close contact because of the type of work they did, it may result in that work site not having people to work at it, but we don't close the site itself down. Both of those situations are triggered by more than 2 cases at a single location. So again, one person in one work site would not result in an identification as a work site public health investigation on the website. We do work with every work site if there's someone that's been working there to make sure that any close contacts are quarantined.
And then I guess, just a quick follow-up, are those active? Because I guess it sounded in the beginning of your comments like those were active. And I guess, are you surprised that it's only 2, considering how easy it is to spread the disease? And there's 2 or more people. Is 2 a good number? Is 2 too high for you guys? What are your thoughts on the 2 that you mentioned?
Sure. So the question again is about these 2 locations in Eau Claire County where we have ongoing public health investigations. We're obviously not surprised because our team is doing that work, and they are expected in this kind of a situation where disease spread can happen, and we know that close contact is likely to result in at least some level of exposure. Some level of exposure, if there's multiple people, again, keeping your circle small is that same idea. If lots of people are exposed, it is more likely that 2 or more people in that setting will be resulting in a public health investigation under this definition. So it's very site dependent. So if we get a case in a larger site where there's lots of close contact, we know that that will likely result in a public health investigation. In Eau Claire County, we have a lot of essential workers working. We have a lot of congregate living situations, so I'm not surprised to have those in our community. Yeah.
Hi, so we've had people reach out to us saying that, I'm 70, 80 years old, I went to the testing that happened, Sunday or Monday, and, I'm 70 or 80, I'm diabetic, I qualify in that high-risk category, but they say that they were turned away. Why were some people turned away for testing this Sunday and Monday?
So the question is related to our community testing on Sunday and Monday that happened in Eau Claire, that partnership between Dunn and Eau Claire County, really under the auspices of testing by the National Guard. Question related to people that may have gotten turned away at that site. We tested everybody that came to the site that had symptoms of any sort, even very, very mild symptoms. I was there for a good amount of time doing the screening, and anybody that had any level of symptoms, we tested. It was the protocol from the National Guard that we were required to use, that only symptomatic people be tested. Anybody that was turned away from that site was only because they did not present with any active symptoms. So it was a requirement that we had only testing of symptomatic people. We were thrilled to have more than 500 people tested during those 2 days. Again, a very large number in a short period of time. And really, it's going to give us a good sense of those people that have mild symptoms, what percentage of them are we going to have positives of. So it was an enormous positive. Some people, a very small number, were turned away because they had no symptoms. Yeah.
Please go back to the group investigations, those sites. Are those 2 cases, are they active or are they done?
So the question was related to the 2 sites that we have that are identified on the website. Specifically, are those active cases? Are those cases that have completed their isolation? I actually don't have current information about at least one of those sites in my brain with me today. I know one of them is active, and we have people from that facility that we continue to work with. I believe both sites we are continuing to have as active investigations. Those locations will come off the state website once they are no longer active investigations. The lag time might be a little bit there, but they're not going to stay on forever.
So you could have had more than 2, there's just 2 active?
Yeah, so my understanding right now, and this is a brand new data point available on our website, the question is related to will they stay on forever or are they only active sites? Our understanding right now is that those are active public health investigations. We'll find out more about whether they will accumulate those over time to have totals at the end. Again, these are 2 sites in Eau Claire County with 2 or more positive cases of COVID-19 at that location, just to understand the definition. Yeah. Yes.
I don't know if you're, early on, I know that you articulated that you said parades should be limited just for educational purposes, car parades, and that around Easter at least you weren't a fan of church parking lot gatherings, although I know those are continuing in the area. Does that change, does your opinion on that change at all on the heels of the governor allowing drive-ins, which do have cars parked for multiple hours next to each other? So does your view on that, those other activities change in light of that?
Sure. So the question is related to the information that we've had at various points in time about gatherings of multiple people, both parade-related gatherings and church-related gatherings, and the feedback in this community that I've given about those being places where the risk is there for people to get exposed to COVID-19. The order has changed over time. As that order has changed, the dial has been turned to allow more activities. The reason for that is that we started in a place where we needed to make sure we had measures in place to respond to increased cases, and we needed those cases, as we've talked regularly about, to have a flattened curve, not an increased number of cases very rapidly. As we go along, we will continue to have the order change. We've already seen that, where more and more things will be allowable. So as we've had from the beginning, parades related to educational events have been part of what has been possible, again, with very strict requirements. Altoona is an example where they worked very carefully and closely with us, with windows closed and making sure people physically distanced. Those things are common sense ways to keep the risk low. The movie theaters recently being open was considered a strategy to again turn the dial. A bit more exposure, the risk is there for people that are leaving their vehicles and seeing friends and family that are in that area. But it's a risk that makes sense at this point as we have increased our ability to respond to the disease and as we have had capacity to treat those people that get ill. That dial will continue to move, and we will continue to have ways that 3 weeks ago we said, absolutely don't do that. We need to be in a spot where we can make sure containment happens. But now, 3 weeks later, we're slowly and progressively opening up our community. That's logical, and it needs to be risk-based, and we are following the guidance of the state on that.
But do you understand my question now? I mean, with the drive-in now having been the green light from the governor, so have you expanded then your view that parades of any type would be allowable and the parking lot church services would be, considering that they're certainly not worse than a drive-in theater?
Sure. So the question is, have I changed my personal view related to parades in general and the various events like having parking lot religious services? Again, my concern in all of these and what I've communicated clearly is that we need to understand risk and put measures in place to mitigate risk. Those allowable activities under, again, essential travel, being out of your home, those things that are allowable under the order are there because we are progressively doing things that have risk, but we think are more easily controlled and more easily put into place in ways that aren't going to spread disease widely. The goal with all of this, and my feedback on all of this, is that the risk is there. We need to be smart about that risk and continue to find strategies and ways to mitigate that risk. Whether it's a parade, generally, which is by definition a very large social event, where people are very close together, currently not allowable because the risk is great because many, many people from all places can be together in a parade very close together. It is one of those definitions based on public health risk that is not best practice at the moment. A parade where people can be in an educational setting, working with faculty, those people in the parade, and students, those people watching the parade, to make sure social distance is maintained, does make sense. So it's very much dependent on the specifics of the situation. We will be following the order in Eau Claire, that is the state order. We will obviously be basing our decisions on risk, and the public health risk is what's most important and what we're communicating out locally. The religious institutions that are doing parking lot parades, we're working, parking lot services, my apologies, we're working with closely and providing input and resources to them about how to do that safely if they're choosing to do it. Yes?
Hi, so as we've said, roughly, you said roughly, 500 tests from the two-day testing site was used, but we did have 600 tests available. Because we didn't use all of these tests, and because we are as a state and as a county trying to increase the number of tests that we give, do you think that we would then expand that pool of who can be tested? I know you said it was just people that showing symptoms who would get tested, but do you think we might be expanding that pool anytime soon? So
Sure.
we did have leftover tests?
So the question is related to testing again, the 500 tests, the more than 500 tests that were done locally versus the hope was to get a throughput of 600 people getting tested. We did not have acquired in Eau Claire and Dunn County 600 test kits. So just so I can be clear with everybody that what we had a great opportunity of was National Guard coming and providing testing to as many people as they could get through in 2 days. We were estimating that we could do, because we set it up in a way that we could get as many people through as possible, we were estimating that we could do up to 300 people a day. We got close to that, and I think that's a success. It is not about the fact that we didn't get all 600 done. Those 600 available tests was really about how many people could we get through in the hours that we had. The test kits came from the state. Those are exact science test kits that National Guard is taking all over the state. Those don't stay in Eau Claire. They were not designated as tests for Eau Claire County. But we are continuing all kinds of ways to get testing to increase. Symptomatic testing is our priority right now. The state is encouraging an expansion as much as possible to asymptomatic testing, and we are encouraging our local providers also to do that. That health alert went out yesterday. So that is constantly changing. You may remember me saying 5 weeks ago, nobody that has low-level symptoms or nobody that's asymptomatic should be tested. We are now, as a state, getting enough supply, getting a better understanding of disease, so we're trying to get more testing to happen. The 600 number that you heard related to the 2 days was really not an available number of tests in Eau Claire to get done, and now we have extras available. It was really a number about how many people can we get through in 2 days. And we were thrilled to get through 500, more than 500 people in those days. Yes?
And just a quick clarifier, the 2 positive cases today, were those both people who got tested Sunday and Monday, or you guys had 2 between yesterday's numbers and today's?
Yeah, the question was related to the 2 people that are positive from the community testing. They are not the 2, not in just in the group that identified today. We may have those over the next couple of days, and I'll give you an overall number from the community testing site, how many positives for Eau Claire County we get, and then reporting over time each day the increased numbers, but they're not a direct match. We'll get those over a couple of days. Yes?
Going back to the facility-wide stuff that was first posted today,
Mhm.
there are 2 actives in Eau Claire County. Can you tell us were there previous ones and what categories those were in?
So the question is, the state is newly posting the county level data on facilities that are having active investigations in them, and have we had previous ones that are potentially were not there previously. The state has posted the ones that we have, and that's what we have been working with. Our other positive cases across the county were related to primarily individual situations, and the two that are listed on the website now are our facility investigations. Yeah.
Related to that, it said one workplace and one group home. Can you name what those two places are?
So the question is related again to the facility investigations that we have. One is a workplace, as the state identified, and one is a group home or congregate setting. And for confidentiality reasons, we're not naming those two locations.
I guess I have a message to people who either live in a group home or work at the place who, does everyone who lives there know, does everyone who works there know, and, other people, people are scared that, they're working or living in a place that is under investigation.
Yeah, it's a great question. So the question is, would people that live in that work site, in that group home, or people that work at that work site be aware that there's an investigation actively happening? And yes, both of those locations, anybody that is at risk, in close contact with that individual, is well aware of the situation. The work site has been working very closely with us and informing all of the workers of the situation. And so there's very good information being shared for those that need to know that. Yes.
There was a Republican news conference last week talking about the regional reopening. One of the business leaders who spoke there said that believes that every person's job is essential. And another state legislator has a news conference scheduled tomorrow. He too has said this. He said every person's job is essential to them. And his news conference tomorrow is specifically on that point. Do you disagree with that statement, every person's job is essential to them? Or at least the contention seems to be this growing sense that every job should be seen as essential.
Mm-hmm. So the question posed is, what are my thoughts about whether every job is essential to the person that has that job, or whether every job is essential? Certainly that is related to the current Safer at Home order that really specifically identifies essential jobs and essential functions that we have. Those have been defined at a national level by our president. Those have been defined at a state level as well, and they are in alignment with the president's definition, really in order in a public health emergency to make sure that we have basic functioning happening. The start of that public health emergency order was really to make sure that we didn't have everything collapse in our society. So it's important that we have that as a starting point. As you've all seen, progressively, at a risk-based way, things have been slowly and progressively opening from that point back in March. We've seen that step at a time. I would anticipate that that continues in a risk-based way statewide, that the nature of what is open will be continuing to expand. And we've seen that really multiple times since the order was first announced. I don't anticipate that changing. Certainly the steps through the Badger Bounce Back Plan, Phase 1, Phase 2, and Phase 3 continue to expand the essential nature of things being open. The essential businesses, though, really comes from an emergency standpoint of what can we not afford to be without broadly as a society. It certainly, and I don't believe it ever has spoken to, nor do I personally believe that it gives weight to some jobs being more essential to the individual person than others. This is really a population definition of what's essential to all of us as a population.
Question for Dr. Walsh.
Yes, sir.
Yeah, there was a bit of a skirmish, well publicized yesterday between Dr. Fauci and Senator Rand Paul regarding education and Dr. Fauci had suggested that he didn't, his exact words, but the idea that seemed somewhat shaky in terms of the school year starting in the fall, whereas Rand Paul kind of pushed back, suggesting that our kids couldn't afford to continue on in this virtual way. I just wondered, as an interim superintendent, if you could offer some of your take on that.
Well, I was impressed with Dr. Fauci's response that he spoke about public health only. He didn't talk about economic issues. That's what he was being asked about, was the impact on economics. If you're asking about the impact on education, this has had a tremendous effect on education. It's affecting students at the most basic level. You know, we're talking about providing meals for students. There's nothing more essential than that's got to be where we start, that the students receive good nutrition. But they're starting to hurt in their social and emotional, in their physical activity levels that need to be occurring. They're not happening. We're very concerned about that. We're concerned about what's happening at each different grade level, developmental level of our students. We talk about our high school students that are missing out on their senior year. They're missing out on activities that normally occur in the spring, but it's happening at every level along the way. And it isn't just in schools, but in schools, I think we're going to be seeing the impacts of this for a long time to come. We're going to have to really focus in on the social, emotional, physical, intellectual needs of students and the things that have occurred just in these few months. It's going to have a long impact. If you look at a kindergarten student that walks through the door at 60 years old, you know, having missed 5 out of 60 months, that's a significant portion of their life. Yeah, we have to be careful of thinking that was just 5 months. Well, that's had a tremendous intellectual, physical, emotional impact on that student. So we're going to be focusing on what we need to do to shore up those things that are happening with our students.
And so in terms of the fall, I mean, I guess when I hear Rand Paul push back that our kids can't afford to not to continue on in this way and not go back to, I guess it would be the brick and mortar schools in the fall. I mean, can you at least address that slightly?
Well, I think we do have to look at alternatives. I think, you know, we may have to look at setting up our structure differently. Maybe we have an A-B schedule, you know, half the kids in one day, half the other. If we have to look at social distancing and continue to look at that, you know, we have to look at all those different things. Do we have to continue the way we're doing with online instruction? Maybe we do have to go a few months longer. I wasn't indicating in my past comments that means we have to stop doing what we're doing. We have to do what's the best thing to do at the time. But there are impacts, there are effects on what we're doing, no matter what they are.
Thank you.
Mm-hmm.
Thank you, Dr. Welsh. Clearly, a public health epidemic like this does have significant consequences on kids and their development, and also has consequences on those families as a whole. We know that that is true. And certainly as we progress through where this disease goes in the next number of months, there will be lots of decisions to be made about what happens in those settings where our young people gather. Any additional questions? Yes?
About how many test results from the community testing are you waiting on?
We have, the question is related to how many test results are we waiting on for our community testing. We have gotten a large percentage of those back, and I hesitate to give you an exact number at this point because ones are coming in as we speak. But of the more than 500 results, we have gotten many of them back. Again, we tested all day Sunday, all the way through late on Monday, and so those test results, again, 48 hours is on general average. We'll be getting a significant number more coming in later today, we anticipate. All right, thank you very much, everybody. We appreciate the time and attention you're paying to this issue. Again, a reminder to go to the COVID-19 eauclaire.org website. Call the call center if you have questions. Refer people there that have questions that you know that they'll get a good answer at that site, and that's 715 831-7425. Thank you for what everybody's doing to help us flatten the spread of this disease so we don't have a challenge moving forward over the next number of months. And we will be back on Friday to share more with you and give you an update at that point in time.